I'm Dr. Spencer Barney. I'm an OBGYN, and I'm proud to be part of the Utah Institute for Robotic Surgery at St. Mark's Hospital. So a myomectomy is a surgical procedure where you remove a fibroid or multiple fibroids from the uterus. Robotically, we do those for large fibroids, for a patient that has multiple fibroids, and it helps decrease sometimes the pressure they get from the fibroids or the pain they'll otherwise have. The procedure entails putting small incisions into the patient's abdomen through which instruments from the robot can be placed, and then dissecting open the uterus to extract the fibroid, and then stitch that spot back up to close it again. So there's small incisions to place the instruments, but because the fiber is usually larger than those small incisions, often there'll have to be one slightly larger incision to remove the fibroids. And that usually is somewhere between 2 to 3 centimeters in size. So it's not overly large, but is a little bit larger than the incisions themselves for the robot. And that allows us to remove the fibroids in from the patient's abdomen. But after that initial recovery period, patients usually feel better quite quickly. They no longer have the pressure from that fibroid pushing on them, or the irregular bleeding that's caused by it often will decrease quite rapidly because, again, the fibroid is not there irritating that lining in the uterus. And so the recovery process is fairly quick. Patients are usually in the hospital just overnight and go home the next day. We recommend they avoid heavy lifting for several weeks, avoid strenuous activity, but people can go back to sitting at a desk, walking around their house, cooking meals as soon as they feel able, which can be anywhere from a few days to a couple weeks after the procedure.